Welcome to the We Talk Health Podcast, the official podcast for West Tennessee Healthcare. Please be advised that this podcast is not intended to replace any medical advice. Always follow your medical professional's advice and direction. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions, please reach out to us at wetalkhealthpodcast@gmail.com, and we will do our best to answer any questions you may have.
Hello, this is Tammy Hardee with West Tennessee Women's Center, and we have kicked Will out of his office again. Got the group back together, our coffee conversation group, and thought we would bring to you a little information about breast cancer awareness. October, everything turns pink, and so if you haven't seen pink, then you've probably not gotten out of your house. But we try to bring about awareness for breast cancer. And so I brought the group together today to talk about some things. We want to talk a little bit about the symptoms. We want to talk about some prevention, some things that you can do. So we will kick it off with Carrie first, and she's going to give you a little information.
Well, great. Thank you, Tammy. I'm Carrie Ann Knox with the Kirkland Cancer Center, and I'm an RN there, but I do a lot of community outreach and a little marketing there. So breast cancer testing is one of the things I want to just talk about. Everybody out there wants to know what saves lives, and actually breast cancer screening saves lives. So what do I mean about screening? Screenings are just recommendations from national organizations like the American Cancer Society that tells us at what age should we start checking our breasts to see if there are any anomalies going on or any issues going on that we don't know about. Screening is not for women with current breast issues. If they're currently having a lump or redness on their breast or some type of drainage that they've never seen before, it's not for those women. They need to go directly to their physician. But scheduling a screening is one of the ways that saves lives. Now, American Cancer Society, you guys, they have had some fairly recent changes in breast cancer screening. If you ask any just bystander out there in the world and just say, at what age should you start getting mammograms and breast screening? They'll probably say 40. Do y'all agree? Yeah, probably 40, right? 40. Okay. Well, that actually changed a few years ago. American Cancer Society, one of our national organizations, said that starting at age 45, you start getting your annual mammograms. And that's the biggest change, that the guideline recommends that a woman of average risk start annual screenings and mammograms at age 45.
So if I'm 40 and I would like to get a screening, like I'm scared or nervous about it, are they okay with doing that?
Tammy, that's great, because women ages 40 to 44 should have the choice to start breast cancer screening with yearly mammograms if they'd wish to. That was an excellent question. Thank you. Thank you. Actually, again, let's go back. Screening, again, is to find out, sorry, ladies. I got to look. Screenings are mainly for women at average risk. So if you're at high risk for breast cancer, that screening age is not for you. Maybe you're a 30-year-old, and because you're high risk, you need to go in and have screening and mammograms sooner. So what puts us at high risk? So a lot of us are going to start talking about that. You're going to hear from all these different people, like when in exercise and diet and all those things. So I'm not going to go totally into that, but I will say this. If you have a first-degree relative, like a parent, a sibling, or a child that had breast cancer at a fairly young age, you're at high risk, okay? And others here, Emily and Amy will tell you more about what puts you at a higher risk in the categories they're responsible for talking about today, okay? So women, always remember, so now the age is 45. You need to go in at 45 to get your annual screening and mammogram. One other thing, you can transition from annual mammograms and screenings after you turn 55. Isn't that wonderful? You only have to go every 2 years after you turn 55 years of age. So you can transition to every 2 years. Some women want to keep it every year. That makes them feel comfortable. Wouldn't you understand that?
Yes.
Yeah. It makes them feel comfortable. They've been going well all of this time and say, hey, as soon as I change to every 2 years, something's going to happen. And I can understand women feeling that way. But it's really recommended at age 55, you can switch or transition to every 2 years.
I think women would be a little bit hesitant about that change, even though I understand they've made it. But so many times cancers are too small to be felt. And so therefore, women are worried that there might be something forming in there that might not get caught for 2 years. So I can understand being a little leery, like you mentioned.
I can too.
Of that.
I can too.
Because I honestly say I can feel that way.
Yes,
a little bit.
Yes, I do too. I'm going to mention one other thing, and we're going to pass it around to everyone else because there's so much good information here. Another thing where people in the community are always asking me for self-breast evaluation cards, how you're supposed to touch your breast every month. Do you know that the American Cancer Society does not recommend that any longer?
Wow.
They do not recommend that any longer for you to do a self-breast examination in the shower or laying down on the bed. It hasn't proven to make any real difference. It hasn't proven because the mammogram can pick up things much smaller, just like you said earlier, Tammy, than we can feel. Sometimes, I don't know if some of you out there know the fake breasts that would be on these tabletops when you have health fairs and all of that, and you can actually pick up this fake breast and try to palpate and feel for those lumps. And sometimes you say, well, the instruction sheet says there's a lump here, but I cannot feel it. Well, that's exactly why. Because a lot of small lumps we cannot feel on ourselves, so we need a mammogram instead of going the self-breast examination route, saying, well, I didn't feel anything this month, I'm cool. So we can't really do that. American Cancer Society does not recommend that anymore.
So in that case, would it be wise to just at least, even if you said you don't have to do the checks, would it be wise to say, but still know your body, know your breast?
Tammy, you have got the best questions today. Yes, that was the next thing I was going to say. We're just asking young women to know how their normal breasts look. If the left breast is a little bit larger than the right one, it's okay. That's normal for you. So you know if that changes, that's a change. And that's one of the signs and symptoms we look for, not just lumps, but changes in the appearance of breasts. If your nipples always point down, it's okay. But it's when one starts pointing up, you have to worry about. Was that too much information? Was that TMI? We're all women. This is coffee conversations. Okay. All right. Okay, enough of that.
Okay.
I'm going to turn it over to Amy, or I'll turn it back to Tammy.
So we've talked about some of the risk factors. So the next thing is going to be some prevention. And Abby, you've got some dietary suggestions?
Yes. So my name is Abby Mays. I am an inpatient dietitian at the hospital at West Tennessee Healthcare. And today I'm just going to share some nutrition information related to reducing your breast cancer risk. We know a lot of those just come back to healthy eating in general. Overweight and obesity do tend to be very much risk factors for any cancer. Not just breast cancer, but specifically with what we're talking about today. I know Emily is here with us. She'll talk a little bit about the physical activity portion. But as far as the nutrition side goes, limiting fats. We know fat is a big caloric intake for a lot of people. When I say limit fat, cut out some butter, cut out full fat dairy. If you do, heavy whipping cream, if you do 2% or whole milk, try to cut back to skim or low fat or almond milk even. So one of the biggest risks with breast cancer is overweight and obesity. From a nutrition aspect, limit your fats. If we use butter, whole whipping cream, whole milk, even 2% milk. We recommend to cut back to 1% or skim milk. Almond milk, those things are going to be healthier options. Poultry skin and fatty meat, we want to limit those. As far as what can we transition to instead of just cutting those things out, think of your healthful fats. I worked with Emily for a few years, so when I think of avocados, I think of Emily. She loves avocados. That's a healthy fat. Olive oil, nuts and seeds, your fatty fish. So that's not a contraindication on limiting fats. Fatty fish are healthier fish. So you think sardines, you think salmon, mussels, all those things. Probably salmon. Salmon is the only one that we're going to eat in here. Maybe sardines. Does anybody eat sardines?
I love sardines, but I will have, I'm not a fish person, but I cannot think of one person that eats mussels.
Yeah.
Yeah, I don't either. Except for Will.
Except
probably.
for Will. Yeah. Ground flaxseed also falls into that category of more healthful fats. And just a plug for ground flaxseed, I always make sure my patients know whole flaxseed is not tolerated by the body. It will not break down, so it has to be ground flaxseed that you buy.
And I've got some hold at home. Thank you for telling me that.
Yes. One of the biggest things that I think has been a myth per se in the nutrition realm for breast cancer risk is going to be the topic of soy. I know that's always been something on a lot of people's mind. I've heard that at health fairs that we've had, especially in our elderly population. And the recent research shows that whole foods from soy are okay. Now, things that are not whole, so things that are not soy milk, soybeans, and tofu, those are your main soy products that are natural. Are probably, the other things are probably things to stay away from. So again, tofu, soybeans, and soy milk are okay.
What about tempeh?
Tempeh would probably be okay because it falls in that soy-based category.
Okay, what soy product would you avoid?
What about, let me just jump in for a second. What about the soy protein powder? I know I switched a couple of years ago to whey protein powder, but I did have a soy protein powder at home. Is that one of those things maybe we can stay away from and go to whey, maybe?
That might be one that you stay away from. The biggest thing as far as is it okay or not, look at that first ingredient. If the first ingredient has soy in it, made from
It's too much.
soybeans, it's okay.
Oh, it's
because
okay.
it's made from the product of soy.
Gotcha.
If that's further on down the line, say second, third, or fourth
It's
ingredient,
more processed.
stay away from and use maybe your whole or your whey protein that you've got at home.
Perfect.
Yes. So those are really the biggest things I think from a nutrition standpoint. Eat healthy, colorful fruits and vegetables at all of your meals. Limit your fat. Change to more healthful fats. And soy is okay as long as it's from whole soy food products.
Okay, that's great
I
advice.
love, Amy, how you explain that. I don't think anyone has explained that to me that way. The whole foods in the soy category.
Yeah.
And the other things, it may have soy in it, but it's too much processing going on. Thank you.
You're welcome.
And I also love that everything that you said benefits total health, not just breast cancer awareness, but heart health,
Right.
diabetes, a good weight. Everything that you just said benefits. There's more benefits than just for the breast cancer
Right.
aspect. So let's talk about the exercise piece.
Okay, first I want to go back to what Carrie Ann said, was talking about they don't really recommend doing the exams in the shower, but knowing your body, and I will say that's how I found a lump in my breast and went on and got all the screenings done and the mammograms, and it turned out to be nothing, but it was kind of cause for concern, and it really worried me, and I was in my early 30s, and that's something that I continue to check now, make sure it's not growing or getting bigger.
Amy, that's great. So there's always an outlier out there, or that self-breast examinations are good. So I'm grateful. But that's a part of also knowing your breast because you've always done it, right? And you're always continuing to do it.
Yes.
Fantastic.
So like Tammy said, I'm Emily from Lift Wellness Center. I'm the Marketing and Community Outreach Manager at Lift. I do a lot of marketing, but we also do a lot of stuff with our community. And today I'm going to talk about exercise. So, for example, according to the American Cancer Society, getting more physical activity is associated with lower risk, kind of like eating healthier and making sure you're doing your screenings. Exercise benefits the total body and improves your mood and reduces your depression and anxiety, but it also prevents weight gain and obesity, which is a direct link to increased cancer risk. There's a lot of different types of exercise you can do. If there's not one that you don't like, just avoid it. So at Lyft, we have a program called Exercise is Medicine. So we deal with people of all walks of life, but we actually have a cancer fitness program. So if you or a loved one actually have cancer, we would love to help you with that. But some other things, just overall, yoga is really good for limiting stress in your life, and we offer a lot of yoga classes, or there's all kinds of yoga classes online or YouTube videos you can look up. Also, they really recommend strength training for longevity of life. I know we're talking about women's health and breast cancer, and a lot of women get on this cardio bunny kick, and they're like, oh, I don't really know what to do, or cardio's easy for me, and I lose the weight quicker, but you're also losing muscle. So if you're not building that muscle, you're losing it.
And isn't it important with breast cancer, or any cancer really, is that vitamin D? I kind of left that out on my nutrition topic, but vitamin D and calcium, I mean, good bone health has to do with physical activity as well.
Oh, absolutely. So, maybe not going to the gym all the time, but getting outside and getting some exercise, even if it's just walking.
Right.
And maybe you're walking with a friend and catching up with a friend, or maybe you're having a walking meeting at work and you're having a one-on-one. Or maybe you're listening to this podcast while you're walking. But anything to move your body, it keeps your stress levels down and increases your the sleep benefits. And, also when you're sick, it helps decrease the times that maybe you're in the hospital or maybe you're sick, and it helps prevent chronic diseases.
Emily, I was thinking about something when you were talking about moving your body. So many women out there, and not just women that are dealing with breast cancer. Sometimes once we get to that wonderful seasoned age, we get tired and we just want to come home from a long day's work and just lay on the couch or whatever. And then we say, okay, I'll do exercise tomorrow. And then tomorrow comes, and then, you
say it the same thing tomorrow. Or I'll get up in the morning and do it.
Right.
I'm guilty of that.
Exactly. You know what I have experienced and what my testimony is for exercise, even when I'm tired, if I can just find some little bit of willpower to get up and do it, I'm revived after that, Emily.
Right. Get your blood flowing.
I feel revived. That's exactly what happens. Your blood flow gets nice and moving around, and your endorphins. We produce endorphins, which means it's our own little feel-good medicine. And
what I like about it is she said, walk with a friend. And we as women, our friendships are so important.
Oh, they are.
We get each other. We depend on each other. We can help carry each other's loads sometimes. So just that, there's more to it than just that physical walking with a friend. You're sharing some company and sharing stories, and that helps to decrease stress, and it also helps to, building those relationships. So that's important.
That's kind of, we're not really talking about COVID right now, but also there was kind of a lot of studies done about people over COVID. We were kind of separated from everybody. We didn't have our friendships, but everybody was picking up the phone, or we were FaceTiming, or we were having Zoom meetings. And maybe we can get back to that now and go meet up with a friend, or go to a class with a friend. Grab your friend and say, let's go to bar, or let's go to yoga, or let's go walk. It could be anything. Or go get your bike out of the garage, dust it off, and go ride around your neighborhood.
That helps me more than anything, is to have somebody there as my accountability partner.
Absolutely.
Or I am not going to exercise. I can't can't get motivated if I don't have somebody to help keep me accountable.
And it kind of goes with what Carrie said too. She gets tired, and I work a desk job a lot of times, so I will be sitting there at 2 or 3 o'clock in the afternoon, and I'm just like, I could take a nap. So I'll go outside and walk a lap around where I work, and it just kind of like wakes me back up.
It does.
Or I have a standing desk, and I'm standing up. And
It does.
just movement. Our bodies are made to move. They're not made to be sedentary.
All right, so let's talk real quick about some things to look for breast cancer signs and symptoms.
Okay.
It's a little broad, but basically, number one is just know your body. Know what's normal. So if anything abnormal should appear, get someone to take a look at it soon. There could be some swelling, some skin irritation or dimpling, the breast or nipple pain, nipple retraction, redness, scaliness, thickness, discharge. Any of that are symptoms. It's not normal, and you should have somebody take a look at that.
And Tammy, sometimes there is no pain, there is no discomfort.
Yes.
You might feel a little something that's different, or you might say, well, that swelling's never been there before, or why does one breast look like it, retracts a little bit and the other one just, But sometimes pain is not involved at all in the symptoms, but sometimes it is.
Right. Risk factors, your gender plays a big role. We know being women, we're more likely to get breast cancer, but men get breast cancer too. So many people don't realize it, but because men have breast tissue, they can get breast cancer. So even for men, they need to know their bodies. They need to look for swellings, lumping, dimpling, anything changing on a man. They need to have that looked at as well.
Right.
Men are embarrassed. They want to ignore it. They don't want to go see a doctor because it's a woman's disease, but it's not.
It's
it
not a
affects
woman's
men as
disease.
well.
Absolutely.
Even though we market breast cancer as pink and make it all womanly, it still does affect men. And it also affects men in the way that breast cancer affects men, in the way that when their loved one gets it, it affects their life and changes their life as well.
It does.
So,
Tammy, when we were talking about earlier what puts you in a high-risk category, and as Abby mentioned, obesity, and Emily mentioned, not exercising your body, not moving your body, all of those things put us in a high-risk category. But some of the other things that we don't have any control over, things like if you as a woman started your period before age 12, that puts you in a higher risk category for breast cancer. And if a woman knows that and she has a lot of these extra high-risk things going on, then she can talk to her doctor, her provider about that and say, maybe I need to get screening or mammogram a little bit earlier. Maybe my mother or father didn't have breast cancer, but I've got these other things going on. Also, if you start menopause or the change of life after age 55, that puts you in a higher category for risk.
It's easier for me to record all of it.
bless your heart. Okay, so another thought is childbirth. Women who do not have children or who have children and don't breastfeed, those two things could place them in a higher risk of having breast cancer later in life.
And Tammy, other risk factors that the CDC, Center for Disease Control, mentions are just naturally getting older. Naturally getting older puts you at a higher risk, and any type of radiation treatment to the chest area. So, we just need to be aware of all of those things. If a woman knows that she's had some radiation due to a thyroid issue, and she'll know that may have put her at a higher risk. If we know what puts us at a higher risk, then we can talk to our provider and say, I think I need to go get screened a little earlier. It's about taking care of yourself. Do you know that no one is going to take care of you better than you take care of yourself? So women have to be their own advocates. We have to say, hey, I think we need to do this and this. And doctors love that. Providers love for you to be as, invested in your own health.
You may not know the answer to this, and that's okay. And I know there's no stupid questions, but with the guideline changes that the American Cancer Society has put out, does that change insurance's thought on paying for mammograms earlier than 45?
That's a wonderful question, and everyone has asked that question. Well, not everyone, but people that are in the know saying, hey, is insurance going to say, no, we're not going to pay for that?
Right.
But because the American Cancer Society has put in the fact that if you want to, between the ages of 40 and 44, go ahead and have a mammogram, that's your choice. So the insurances, most insurances will pay for that. And if you have a reason, you guys, if you're younger and you need to go ahead and get your screening done younger, then definitely if a doctor has put down that in your record that you've got a first degree relative with breast cancer or ovarian cancer that had it at a young age, of course that puts you at a higher risk. I don't care if you're 25 years old.
Right. Good. That's good to know.
Okay, so I guess in summary, we just do need to bring up a little bit about things you can and can't change. You can't change your family history.
Correct.
You can't change your age as you're aging. You can't.
Well,
those things you cannot change.
You can lie about it a little bit.
You can lie about it, but
Okay.
it doesn't change the
Okay.
chemistry. You can do all kinds of things to fake your age, but the things that you can change is your diet, your exercise, your choices as far as drinking, smoking, inactivity, those things you have control over. And making the changes that each of y'all discussed today will help you not just with breast cancer prevention, but it will also help you with heart disease prevention and just a better quality of life. Is there anything anybody else wants to say before we wrap this one up?
And speaking of screenings and mammograms, just want everyone to know that the Kirkland Cancer Center usually does a annual breast cancer screening for uninsured women. So please check out our West Tennessee Healthcare Facebook page for the details, or WTH.org. It usually happens in October or November every year.
I'm just glad we got together and talked about this. I think this is all really good information that hopefully somebody can use. I'm really glad to know about the 45. I didn't know that guideline had changed, but
You know, there's been so much emphasis put on pink in October and breast cancer. Because so much emphasis has been put on it and we're being advocates for ourselves, breast cancer has literally been going down a little bit over the last
good.
15, 20 years.
But unfortunately, the statistic is still 1 in 8 women
It's still
will be
1 in
affected.
8. It's still 1 in 8.
And I look forward to the day where that starts changing.
Yes, absolutely.
So, guys, I think this was great. I had so much fun, and I can't wait to do it again. Maybe we'll get together a little bit closer to, right after the first of the year and do something about Heart Month, and we can talk about women and heart health if you guys want to do that.
That'd be
Sure.
great.
That'd be great.
So, thank you all for being here. Thank you guys, especially you all, for listening to another episode of We Talk Health.